Today I am going to talk to you about anatomy of the heart, and it's very important, and kindly focus your attention towards me. Listen what is happening, and I'll try to finish it little earlier so that we can revise, and I should know from you how much is the receptivity of your mind, right? Or that will help me out in finding what is to be suggested so that you can listen better, and I should be able to correct myself also or add or something like that. So with these words we'll start off. Okay. I am going to talk to you about anatomy of heart, basics only. We don't have to go into exhaustive details, but you should understand basic anatomy. Heart is obliquely placed in our middle mediastinum. You understand? First sentence is heart is obliquely placed in the middle mediastinum. 2/3 of it is on the right side, left side. 2/3 of it is towards the left side, and 1/3 is towards the right side. Only 1/3. And it tapers, the ventricles tapers at that point which is called apex. Alright. Heart has got 4 chambers. How many chambers are there? 4 chambers. Heart has got 4 chambers. Upper 2 are atria, and lower 2 are the ventricles. So we have one right atrium, we have got one left atrium, right ventricle, and the left ventricle. Is that clear? Both the atria, they open, the right atrium will open into the right ventricle, and left atrium will open into left ventricle. And there are the opening between the atrium and the ventricle, they are the atrioventricular aperture. This is oval shaped, right? Both sides. But we have other openings also in it. And what are those openings? We'll talk about valves later. You see, the right ventricle ejects blood into the pulmonary artery, and pulmonary artery takes the deoxygenated blood into the lungs, where it is oxygenated and returns via pulmonary veins into the left atrium. Is that clear? What I mean to say, I'll repeat again. We have 2 atrium and we have 2 ventricles. The right atrium receives here. This is the right atrium. This is the right atrium and this is the left atrium. This is the right ventricle. This is the left ventricle. Is that clear? So, right atrium and right ventricle, they are communicating to each other by oval-shaped opening, which is guarded by valves. Valves. On the right side, right atrioventricular valve is called tricuspid valve. Tricuspid. It has got 3 cusps. That is why it is called tricuspid valve. These tricuspid valves open into the right ventricle. Is that right? Similarly, the left atrium and left ventricle communicate to a bicuspid valve, which is having 2 cusps. Okay? And deoxygenated blood comes to the right atrium from the superior superior vena cava. Superior vena cava. Here is the superior vena cava, okay? And here we have the inferior vena cava. Right atrium receives blood from superior vena cava and the inferior vena cava. Is that clear? Similarly, the left atrium receives the oxygenated blood through the pulmonary veins which comes from right and the left lung. This is oxygenated blood. So here the left atrium will receive left atrium will receive oxygenated blood from the lungs through the pulmonary veins. Is that right? Now, right ventricle will eject blood through the pulmonary artery into the lungs. Take it? Right and left pulmonary artery, and it will go into the lungs. See that? So pulmonary artery will carry deoxygenated blood from the right ventricle into the lungs. Right pulmonary artery and left pulmonary artery. Right? Which branches? Pulmonary artery branches right and the left branches. Take it? And it gets oxygenated with the oxygen we have in the atmosphere. And this oxygenated blood then returns through the pulmonary veins. Generally we say that veins carry the deoxygenated blood. But here the case is different. They are bringing blood, oxygenated blood from the lungs back into the left atrium. And left atrium, the oxygenated blood goes into the left ventricle, and from the left ventricle, there are two circulations. One is the pulmonary circulation, the other one is systemic circulation. So the oxygenated blood from the left ventricle goes into the aorta. Aorta is guarded by, when the ventricles contract, the blood goes into when the left ventricle contracts, the blood goes into the aorta. And the entire oxygenated blood is distributed rest of the body. Is that right? The aortic orifice is guarded by the aortic valves, which is called semilunar valves. Semilunar, lunar like moons. So there are three cusps in the aortic valve. Okay? Whereas pulmonary artery has got how many cusps? There are also three cusps. Okay? So these are called semilunar valves because of its shape. Okay. Now next, which comes to our mind is, we have how many chambers? 4 chambers are there. And left ventricle, because it has to force and eject the blood to the entire body, so therefore the left ventricular wall is much thicker than the right ventricular. This musculature is called, what is it called? It is called myocardium. Myocardial muscle. But natural, since it has to eject the blood against resistance. So therefore the musculature, the wall of the left ventricle is much thicker. It is 10 mm thick. How much? 10 millimeters. Whereas the right ventricle has to eject blood only to the nearby station through the pulmonary artery, that is the lungs. So it is thinner. Its thickness is around 3 millimeters only. Now, to separate the oxygenated blood from the deoxygenated blood, right-sided heart has got deoxygenated blood, venous blood, which is coming to us from the periphery, right? It contains so many things, the products of metabolism like carbon dioxide, urea, creatine, all the waste products, they are coming to the right side of the heart. And the left side is having oxygenated blood. You can't mix these. And if there are some congenital abnormalities where the blood is mixed, venous blood is mixed with the oxygenated blood, the patient will have cyanosis. So therefore, both the atrium are separated by a septum, which is called interatrial septum. Interatrial septum. What is it called? Interatrial septum divides the right and the left atria. And both the ventricles are separated by interventricular septum. So interventricular septum too has to face, too has to encounter the resistance. Left ventricle has to do a much more, this is contractibility is much more than as compared to the right ventricle. So therefore, interventricular septum is also quite thick. It is also 10 mm in thickness. Is that clear?
Yes.
Okay. So, besides this, now heart, what is the function of the heart? It carries, it sends deoxygenated blood to the lungs for purification, oxygenation, and receives the oxygenated blood for distribution to the various parts of the body. So therefore it contains oxygen, it contains nutrition, it contains minerals, it contains hormones, right? And thereafter the peripheral tissues, they get nutrition, oxygen and nutrition, right? Now heart has got one quality, unlike the skeletal muscles. Now I'm moving. The skeletal muscles are under my control. Alright? It is at my own will that I am raising my hand. The action potential is raised, muscles contract. You know, muscles, skeletal muscles, they have got what? They are bundles. And there are muscle cells and muscle fibers. And there are thousands of myofibrils also. There is multiple nuclei under the muscle fiber ball, sarcolemma. It's a multinucleate cylindrical cell, and you can action potential is raised. There's a depolarization and repolarization that we will discuss later, but I think I have explained to you earlier also. But a cardiac muscle has a quality which is quite different from the skeletal muscles. It is not under the voluntary control, except heart is supplied by, the nerves which are there for functioning of the heart. There are autonomic nervous system is there, sympathetic system and the parasympathetic system. Since sympathetic system is responsible for contractibility and force of contraction and the rate of the heart. Okay? It regulates its heart rate. So heart has got quality that the cardiac muscle acts automatically. Even if you disconnect it, the cardiac muscle will still contract automatically. Is that right? And it has got a rhythm, regularity. The heart rate contraction is a very powerful coordinated movement. It is something like that. This is, see, now suppose this is the ventricle, this is the atria. So this is contracted, this is relaxed. This is the movement. And the rate is say 70 to 80 and it is regular. The rhythm is regular, right? And it is not under the voluntary control of anyone. Right? It has what we call the characteristic of automaticity and rhythmicity. The rhythm, heart rate is regular its rhythm. So what makes it have this regular rhythmicity. So therefore, we have in right atrium, we call it sino-atrial node. What do we call? Sino-atrial node is a place. This is a muscular tissue, special muscular tissue, which is about 2.5 centimeter. It is also crescent shaped structure. Sino-atrial node. It is a muscle. There are coils of muscles in it, right? And there is something called a substance of P cells, from where electric current is generated. Impulse is generated at the powerhouse of the heart. Sino-atrial node. What is it? Which is, what is the location? Right. That's right. It is located in the right atrium, where the superior vena cava enters the right atrium, anterior and lateral to the opening of the superior vena cava. There is sino-atrial node. What? Sino-atrial node, which is about 25 mm to 2 mm in breadth. So different books say different kind of resistance. So sino-atrial node is located anterior and lateral at a site where superior vena cava opens into the right atrium. So this is the sino-atrial node here. Anterior and lateral. It is a crescent shaped structure. Right? And it generates an impulse. What does it do? It generates an impulse regularly. Alright? And these impulses go into the atrial musculature. And there, this impulse travels to the left atrium also. You get my point? The sino-atrial node generates the cardiac impulse, and this impulse travels to the musculature of the both atria, and it also goes to atrioventricular node. So atrioventricular node is located anterior-inferiorly close to the interatrial septum. This is your AV node here, atrioventricular node. But it does not, at its own, if it is dissociated with the sino-atrial node, there are 3 internodal tracts, internodal bundles, which connect the sino-atrial node and the atrioventricular node, anterior, middle and posterior. What did I say? So there is this is one circle here and one like this. Right? So there are internodal bundles between the sino-atrial node and the atrioventricular node. If God forbid, sino-atrial node has got an arterial splice, small artery splice blood thread. So therefore, if there is something goes wrong with the sino-atrial node, it is a pacemaker of the heart. It is a pacemaker. It generates electrical impulse, and something goes wrong with the sino-atrial node, then the atrioventricular node will still generate the impulse at its own, but it is not as strong or not as frequent as sino-atrial node. Right? You get my point? Or there may be complete dissociation with it. Rhythm is lost, and this is called arrhythmia. What is it called? Arrhythmia. When this regular rhythm is disturbed because of conduction problem, there will be arrhythmia. It may be regular or irregular. Sometimes the heart rate goes to 40, sometimes it goes to 30, sometimes there is a pause also, depending upon the pathology. There is a pause. The heart is not contracting. You get my point? So therefore, atrioventricular node also has got power of generating its own impulse, but it may be somewhere around 40 per minute or so. You get my point? So the conduction, the impulse which has come from the sino-atrial node, it goes to both the atria, right and left, and it travels to atrioventricular node. And from atrioventricular node, what happens is, this is an interventricular septum. I'll make it thicker, right? This is the sino-atrial node, this is the atrioventricular node, right? Either cava is open here. This is inferior vena cava and it opens somewhere here, right? This is the atrioventricular node. So, from the atrioventricular node, what happens is, the impulse goes into the, from atrioventricular node, there is a structure called bundle of his at the junction of membranous and muscular part of the interventricular septum. This is the interventricular septum, which is much thicker than the atrial thickness or the ventricular thickness, right ventricular thickness. So the right ventricle wall is thinner as compared left ventricular wall, right? Now bundle of his has got an anterior vesicle which goes to the left ventricle and it divides into right-sided bundle branch, divides into and the left side also. Now it goes into the cardiac muscle, right? Here, this is the atrioventricular node, there is a bundle of his, and at the junction of the membranous part with the muscular part here, it divides into right side and left bundle branch. Okay? And there is the anterior branch and this is the posterior vesicle. And anterior vesicle and the posterior vesicle. And finally, what happens is within the musculature, there are thick and numerous branches which are called, what are they called? Purkinje fibers. Purkinje fibers. Right? What these are called? Purkinje fibers. Are you understanding? Sino-atrial node, which is the pacemaker, heart's pacemaker, which is muscular tissue with a small nutrient artery. The impulse is generated there, it goes into the both atrial muscle and also to the atrioventricular node. The atrioventricular node is located at the inferior aspect of the intra-atrial septum. You get my point here? And from atrioventricular node, the bundle of his is there, which divides into the right side and the left side, left bundle branch and right bundle branch. Is all right? And it is embedded inside the interventricular septum. So, but here what happens is the impulse, like in atrium, will not go to the directly to the atrial musculature. They take over. Purkinje fibers are there within the muscular wall, and this divides into branches like this. You see that branches are there. Small branches go into the muscle wall, and then Purkinje fibers supply the entire muscle. So, why this kind of a mechanism is there? Why this kind of a mechanism is there, where there is a strong coordination in all the muscles here, they contract simultaneously, unlike in, say, other places. Here, the bundle of wrist and the bundle branch in the interventricular septum, they are covered by the fibrous tissue. So, it cannot go to the ventricular muscle part directly, right? It has to go to the Purkinje fibers. Now, what is the mechanism of contractibility of heart? So, when both the atrium, right and the left atrium, they will contract simultaneously, right? Once these atria, the impulse causes it to contract both the atrium. So, bicuspid valves, the mitral valve, this is called mitral valve. The left atrium, left ventricle, they have a valve which is bicuspid valve, which is also called mitral valve. So, mitral valve, when atria contract, both the atria are contracting, the blood this is a diagrammatic thing so here the valve is called bicuspid valve like this, right? And this is the tricuspid valve. They will open. Now, once the atria are contracting, the blood will, this mitral valve will open, and here the tricuspid valve will open. Tricuspid valve will open, and the blood comes into the ventricle. Right? When the atria contract, the blood will come into the bicuspid valve, the mitral valve and the tricuspid valve will open, and blood comes into the left ventricle. But once so, that means ventricles are getting filled up. When the atria are contracting, the ventricles are not contracting, they are getting filled up. This is a state of diastole. Right? So, once the blood has come inside, there is a pause at bundle of wrist for 0.1 second. There is a pause, there is a small pause at the atrioventricular node. The impulse is arrested there for 0.1 second at atrioventricular node. Sino-Atrial node has sent the impulse for contraction. And once the impulse action potential is raised, the atria will contract, right, and eject the blood into the ventricles, and both the valves will open up. The cusps of the mitral and tricuspid valve will open. You get my point? Are you understanding this point? But there is a pause for 0.1 second for atrioventricular node, so that it should not, ventricle should not contract prematurely while the blood is being brought into the ventricle from the atria. If the impulse continues into the ventricles, interventricular septum, and the ventricles contract even when the atria have not expelled this content totally. So to give it a little time, the atria should completely eject its blood into the ventricles. There is a pause of 0.1 second. Are you getting it? And once that is there, the ventricles contract. Now once the ventricles contract, what will happen is left ventricle. Now let us see, the left ventricle is contracting. So these will close. The ventricles are contracting and this will close. So the blood during the contraction of the ventricles, left and right ventricle, the blood cannot go back into the right or the left atrium because these bicuspid and tricuspid valves, the cuffs, they are closed now. Once there is a pressure of the blood, so these valves, they are open when the atria are contracting and blood is coming into the ventricle. But when the ventricle is contracting the force, these valves will close and blood cannot go back into the left atrium. So where does the blood go? So blood will go from the right ventricle and go into the there's an opening here and will go into the pulmonary artery. So these semi-neural valves will open. The aortic valve, and there are these valves open like this. So with the force of contraction, the valve, the blood from the left ventricle will enter the aorta because aortic valves will open up. Now aortic valves have opened up like this. These are the valves and the blood from here goes into the aorta. Right? This is the pulmonary artery. It will be like this, it will be like this, and it will emerge from here, right? Similarly, when the right ventricle will contract, so these valves will open and blood goes into the pulmonary artery. And once the atrial contraction starts, once the entire blood from the ventricles has gone into the pulmonary artery or the aorta, then these valves will close, semi-neural valves will close and blood cannot return from aorta, pulmonary artery back into the ventricles. समझ गए ना आप उसको? Okay. So then we will be studying the cardiac cycle also, that I will take next time. For today this is good enough. A little bit of anatomy of the heart. The heart has got, I'll just revise quickly. It has got 4 chambers. 2 atria are there and 2 ventricles. The atrial walls are thinner than the ventricular walls, obviously. So pressure is also lesser in that. Right atrium barely has got pressure of how much? It may be 0 to 5 or 15 mm of mercury. Whereas in left ventricle the pressure may be, the systolic pressure may be somewhere right, anything above 90 to 140 or so, right? So atria receives blood from on the left side it receives oxygenated blood from lungs through the pulmonary veins. Right atrium receives deoxygenated blood from superior from the various parts of the body, which is containing the products of metabolism also, and waste products, whatever it is called, deoxygenated blood including carbon dioxide. This comes through the superior vena cava and the inferior vena cava. right ventricular wall is thicker because it has to force the blood to distant sites. So therefore, with the force of contraction and thickness of the wall, the blood is ejected out. It is a voluminous structure. The wall of the ventricle is thicker, which is somewhere around 10 mm. Whereas right ventricular wall is about somewhere around 3 mm. Atrial wall is somewhere around 2 mm or so. And these orifices, which are oval shaped in structure, they are guarded by valves to control and regulate the flow of blood into the ventricles. These are, on the left side, we have atrioventricular valves are called bicuspid valves. And on the right side, these are called tricuspid valves. Whereas the aortic and pulmonary valves are called semilunar valves. They are called semilunar. Semilunar means semilunar. It's half moon shaped, right? Is that right? And once the ventricles are contracting, the aortic and pulmonary valves, they open up and blood is ejected out. And once it is fully emptied of that, these pulmonary aortic valves close and there are mitral valves, atria contract and blood comes from the atria into the ventricles. Is that right? Then we also said that a cardiac impulse is generated at the, where is it generated? Sino-Atrial node. Sino-Atrial, where it is sited? It is located? Sino-Atrial node is located at a site where superior vena cava enters, joins the right atrium, bringing deoxygenated blood. Anterior and inferior to it is about 2.5 centimeter in long. It is semilunar or crescent shape, and it has got interlacing cardiac muscles. Is that clear? So sino-atrial node, there can be diseases of the sino-atrial node due to ischemia, improper blood supply, or some kind of a degeneration, things like that. It may not be able to generate a impulse. Then what? Atrioventricular node takes over, generates its own impulse, which is insufficient and not normal. So one does require to generate impulse a cardiac pacemaker, which is a program, which is cardiac pacemaker. Have you heard about it? Cardiac pacemaker, that is artificial pacemaker. The sino-atrial node does not work. Heart requires impulse. There has to be the depolarization and repolarization, which involves sodium ions and potassium ions and things like that, and resting membrane potential and what is the speed of it. So what I told you, that sino-atrial node has to function normally, and it works accordingly, which has got a regular rhythm. Regularly the impulse is generated. This is called rhythm, a regular rhythm. It has got that inherent power of generating an impulse, and its rate is also controlled. This is the function of sino-atrial node, to generate a cardiac impulse, which is automatic. It's not voluntary. It is involuntary. You get my point? Unlike the skeletal muscle, where you can do anything. Look at this by skeletal muscles. I am moving my hands and fingers at my discretion, applying how many number of muscle fibers are involved to do a particular function, whether I am picking up a pin or I am lifting the weight. You can't take chances with the cardiac muscles. Then what happens is that sino-atrial node transmits its impulse to both the atrial musculature and also to the atrioventricular node. Now, atrioventricular node then forms the bundle of his. What does it form? Bundle of his. Now it goes through the interventricular septum so that it protects the impulse going haywire. Left, right, and things like that. It is the organized system of contraction, and there is a branch which goes in. Is it over? My time is over. So there is an anterior fascicle, and it divides into right and left bundle branch, and ultimately the musculature is being supplied, myocardial musculature is supplied by their further branches, which are called Purkinje fibers. Now, God forbid, if the impulse is interrupted, say due to ischemia in the right bundle, the person will have right bundle branch blocked. You know that? I have heard. Only suffice to put an impression in your mind that it can cause a disease in the rhythm of the heart, which is called a right or left bundle branch. And we put an ECG. In ECG, you can find out how many leads are there in ECG. Anyway, there's a limb leads and the chest leads. Okay? So wherever we place that indication, once you read the ECG, you will be able to come to know whether it is which part is involved, is the right bundle branch block, left bundle branch block, or to the interventricular septum is involved and things like that. Right? So what else we studied here? What else we was talking? We are talking about that the blood from the right ventricle goes to where? Where does now you tell me, right ventricle of the heart, does it contain oxygenated blood or deoxygenated blood? No, right ventricle contains deoxygenated blood, which has got carbon dioxide, and it comes to the right ventricle from the right atrium. This is the right atrium, this is the right ventricle. So blood in the right ventricle obviously cannot come from anywhere except the right atrium, and it contains deoxygenated blood, which now deoxygenated blood goes, where does it go from right ventricle? Where does it go to? Yes, that's right. It goes into the lungs. For what? For gas exchange, right? The carbon dioxide is expelled. There's a different mechanism altogether. Oxygen is taken from the atmosphere, which is through the pulmonary veins. This blood is carried to the left atrium. You get my point? Oxygenated blood from the lungs will come to the left atrium by the pulmonary veins, through the pulmonary veins. From the right ventricle, the deoxygenated blood will go to lungs for purification or oxygenation. Take it, please sit down. Now you tell me what happens to the blood which is there in the left ventricle. Suppose the atria has filled up the ventricles with the blood. Now, once the ventricular contraction starts, which valve will open? Once the ventricular valves, which valves will open? That's what I wanted to ask you.
So when blood comes from left atrium to left ventricle, bicuspid valve will open, and then when left ventricle blood goes to aorta, semilunar valve will open.
You're right. Once the atria contract, the left atrium and right atrium, left atrium will receive oxygenated blood, right atrium will receive deoxygenated blood. Right? So once the atria were, after the atrial contraction, the ventricles after a pause will contract. Okay? The mitral and tricuspid valves will close, and semilunar valves of the aorta and the pulmonary artery will open, and the blood will go through the aorta into systemic circulation, and from the pulmonary artery it will go into the lungs. Is that clear? So that's all. Thank you very much. That will show. I hope was my talk, understandable? So what you do today, you go back and read, and I will also improve. So please rate my performance. How did you get something out of it?
Yes.
What is the role of the sino-atrial node? Where is it located?
Right atrium.
Yes, it is in the right atrium. That's right. Where? Now you tell me. Where is the? Please sit down. Where is sino-atrial node? Revision हो गया.
से प्रेजेंट होती है राइट एट्रियम से ऊपर और जो वो क्या बोलते हैं हाँ राइट एट्रियम से प्रेजेंट होती है.
Sino-atrial node is, yes, located in the right atrium, but where?
सुपीरियर वेना कावा से बिलो.
Where the superior vena cava opens into the right atrium, the sino-atrial node is sited at the anterolateral part of that opening in the right atrium. ठीक है ना? Okay. And where is atrioventricular node sited? Where do you find the atrioventricular node?
Sir, it is in the posterior part of the right atrium.
That is some books mention. I don't know who is right, but please sit down. Atrioventricular node is at the anteroinferior part of the interatrial septum. This is the interatrial septum, so the anteroinferior part of sino-atrial node is located here. Atrioventricular node is located here, right? Please sit down. The impulse from sino-atrial node, where does it go to? It goes into the, you tell me please. This sino-atrial node has generated an impulse. Where does it go to now? This is electric current, you can say, out to some extent of few millivolts. So sino-atrial node has started. It is generating an impulse, a cardiac impulse. So it will go to both the atria, musculature, and to the atrioventricular node also. Please come. Okay, then let me finish. All right. Thank you.